Hello, everyone. I'm Dr. Gentile, and today we're going to talk about preparing for appointments with a psychiatrist. Here's some things you need to know for navigating psychiatric appointments. First, prepare for the appointment. It's important to be able to provide a summary of the important things that have happened since the last appointment. Next, it's critical for the patient to feel that it's a confidential and private space, that it's safe for them to talk and share their story. The patient's often accompanied by one or more other caregivers or interested others. It's important to address the patient directly, no matter what their communication challenges may be. The next thing is collateral data. So this is the individual that accompanies the patient to the appointment. This isn't simply a person that provides transportation. This really needs to be a person who's familiar with the patient, or at least has collected data from others who are. They should be able to share important things that have happened in the person's life over the last 30 days or so. For example, we can use that information to make important decisions about their mental health and about prescription medications. In psychiatric appointments, sometimes it's the externalizing behaviors, the aggression, the agitation that we think of first, and we tend to focus on that. We also have to balance that with other things that are going well. If we focus on one incident or event in the last 30 or 60 or 90-day period, we may be taking that out of context, especially if the person had one day of distress or was affected by receiving bad news or was sick or was being provoked by another individual. It's also really helpful for the collateral data source to have 3 or 4 bullet points that summarize the time period since the last appointment. These can be things such as new medication changes from other offices, new medical diagnoses, major transitions or changes in the person's life, maybe a move, a new caregiver, loss of a friend, or other things. And of course, any behavioral change that is significant for the patient and other stressors we should discuss. Finally, the medications. There's no miracle medication regimen. Medications should always be used in concert with other interventions. However, neurochemical imbalances cause depression, they cause anxiety and psychosis. These are treatable and can be corrected or resolved with medication. No one should be living with depression or anxiety every day. If you're taking an individual to a psychiatric appointment, you're providing a critically important service. I am so appreciative of the DSPs, the SSAs, managers, guardians, and family members who make sure my patients attend their appointments. Thanks in advance for all you do for our patients with co-occurring MI-ID. DODD is committed to supporting individuals with ID, as well as their families, caregivers, and treatment teams. Please visit dodd.ohio.gov to access these and many other resources today. DODD has your back. I'm Dr. Gentile. Thanks for listening to Preparing for Psychiatric Appointments. Be well.